Okay, this video here is going to be the demonstration of how to correctly bandage the foot after a bunion procedure. One of the things that surgeons do while they're doing a bunion is that not only do they correct the deformity with osseous correction, but also soft tissue correction via sort of your capsulotomy, your capsulorrhaphy procedure, lateral release. So the surgeon wants the soft tissues to heal in that corrected position. So after surgery, there's a few special things that we do with the bandaging to just assist with that corrected position. Our supplies that we have available, we have 4x4s, Curlex, Adaptic, are non-adherent, and then also compressive wrap, which is the last dressing. So most commonly what we will do here with many of the physicians is that they do right over the incision site after the skin is closed, betadine soaked Adaptic. We'll consider that this is betadine soaked Adaptic here, and that will go directly onto the incision site as the first dressing. From that point, we'll usually take a 4x4, fold it in either half or fourths, and that will go in between the hallux and the second digit. Our other 4x4s will then go over the surgical site, fold it there, another one open widely back between the toes, draped across. Then with our Curlex, it can be wrapped around the foot, just some circumferential wraps at first to secure the dressing in place. You can take your scissors, and as it's getting ready to intersect between the hallux and the second digit, you can make a little slit in your Curlex dressing with scissors and actually weave that down and in between your hallux and second digit, and then apply an outward tug on the dressing, and that keeps the toe in more of a rectus position, and then continue to wrap the digit, the forefoot, and then we just continue the dressing up and about the heel for stability to ensure that it stays on. When you feel that you have adequate dressings in place, you can cut the excess. And then what is really physician's preference is the compressive layer, the final wrap. Some people like Coban, and other people like ACE. If you're using Coban, one thing to do or to remember is this can actually strangulate tissue, so what you want to do is apply the Coban with 50% tension. And this has been the demonstration of the application of the post-surgical bunion dressing.